So, as many of you know, I created quite a controversy a few months ago. Well, I use an insensitive term to describe our elected officials who constantly put corporations before their constituents. And I do want to apologize to any of you who were offended. But I also want to say to Ted Lieu that he was not one of the people I was referring to.
Medicare for all will never happen if we continue to elect corporate Democratic whores who are beholden to Big Pharma and the private insurance industry instead of us.
We all know what to expect from Republicans, and thus when they vote against the things we stand for, we kind of expect that. But frankly, we have a real problem in Congress, and especially here in California, where each year more and more progressive legislation is being held hostage by a group of corporate Democrats who continue to do the bidding of big oil, insurance companies, big pharma, and other powerful interests. And that is why we need to work hard to support so many great progressives who are running. Henry Stern, Eloise Reyes, and this is why we need to also support the great work of Trent Lang and his organization to expose and rid our democracy of dark money. Now, I want to give you a little background in terms of why and how I came up with that term. I didn't really come up with the term. It's been used. You heard it used in song today. But the fact is this. In the run-up to the Affordable Care Act, when so many of us were hoping for real bold, innovative health care, a Medicare for all, or at least a robust public option, it should be pointed out that there were 3,300 registered healthcare lobbyists for the 535 members of Congress. That was roughly 6 lobbyists for each member of Congress. And they spent $1.2 million a day, more than what was spent on the entire Bush-Kerry election. And that's why in some respects the Affordable Care Act looks like it was written by the private insurance industry and the pharmaceutical industry. Now, ever since my fateful speech, what have we seen? We've seen insurance rates continue to skyrocket. We've seen many large insurers drop out of the exchanges, and we've finally seen many of the outrageous drug prices like that for the EpiPen come to light. And so I would ask members of Congress, and I would ask those people, and it should be pointed out, when the Affordable Care Act was initially being put together, we had a supermajority. We didn't need one Republican vote. And yet we didn't get any robust public option. We didn't get any Medicare for all as even a potential discussion. And so that's what I would really like to point out. I apologize to all of you in the sense that my term was a distraction from the point that I was trying to make, which is that we have too many people in Congress who continue to put the best interest of the pharmaceutical and the insurance companies ahead of common day patients. Now, while the Affordable Care Act did do some good things, the fact is there was no insurance rate regulation or an ability to prevent obscene drug prices. As a matter of fact, Billy Townsend, prior to the run-up of that, had a front row seat with President Obama, at which time Big Pharma decided they were going to invest a lot of money to make sure that the Affordable Care Act went through as long as drug prices were not touched. So this is the background of how we got the Affordable Care Act. And as you're seeing now, more and more, it's becoming less and less affordable. So I want to share with you just briefly, how is it that an oncologist who had a pretty cush practice seemed to care so much about healthcare? So back in 1966, Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I will tell you that as an oncologist, I've seen this all too often, and I think it's worse now than it was 51 years ago. In the last 25 years since I graduated from medical school, I've seen a system that is far too deleterious and mischievous. Lisa and I and Jet, we welcomed our newest addition to our family in June at St. John's Hospital. And prior to my wife's C-section, our pre-op nurse at that time shared with me that she had been retired. She and her husband were living their dream life in Florida when he came down with lymphoma. And as a result of his long battle with lymphoma, they exhausted all of their medical savings, and that's why she was now back at work. How does this happen in a country, right, that spends twice as much as any industrialized nation on healthcare? And it would be easy for me as an oncologist to sit back and enjoy my paycheck and protect the status quo, but I simply cannot. I've seen far too many of my own patients go bankrupt due to their bouts of cancer, and most of them were insured. And sadly, We have a healthcare system where nearly 1.2 million people with insurance go bankrupt each year due to major medical illness. And over 15 million people each year deplete their savings just to cover their medical bills. And we have a system where 40,000 people die each year strictly because they're uninsured. And we have a system that does not cover our undocumented brothers and sisters, and where 70% of all of our uninsured in California are from communities of color. For people to say that our healthcare system is not broken, for people to say that everything is just fine, it's immoral. We have an immoral and unjust healthcare system. The other thing I will just point out, we have a for-profit insurance industry that has raised premiums over 160% in the last 8 years in the state of California. During the same time, wages have either decreased or remained stagnant. And all the while, we maintain a perverse system that only makes money by denying care. And while the number of uninsured has dramatically decreased due to the Affordable Care Act, the number of underinsured, meaning those who cannot afford to go see a doctor despite having insurance because their co-pays and deductibles are too high, has actually increased. And people don't realize, but in the state of California, we have a $150 billion unfunded healthcare liability. And CalPERS and CalSTRS see unsustainable premium increases year after year. So this is why I continue to fight for a better healthcare system. A system that does not continuously put profits before patients. A system that covers everyone, including our undocumented brothers and sisters. A system where no one goes bankrupt just because they get sick. A Medicare for all system. But until we get there, this is why I fight for insurance rate regulation. This is why I fight to expand Medicaid coverage for our undocumented brothers and sisters. And this is why I will fight alongside President Hillary Clinton for a robust public option. It's a start. It's not quite where we need to be, but it's a start. And I truly believe that we as a society are defined by how we treat the least among us. And I know each and every one of you are here because you believe the same too. Now, many of us here have become a bit discouraged and a bit beaten down. We sometimes feel like the system is rigged and corporations are fully in control. Jeb feels that way right now. But I would encourage each and every one of you to never give up and remember Martin Luther King's words that human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. The tireless exertions and passionate concern of dedicated individuals. And I will say this group here, you guys are some of the most dedicated, passionate people I've ever met, and so proud to accept this award from you all here today. Thank you very much.